Dr. Jason here with MoveWell. This week, talking about the 90-90 hip position and a rotational stretch for the glutes and piriformis. I hurt my back on Friday last week, so this is a stretch that always works for me for both glutes and quads and hip flexor. We call it 90-90 because the front and back knee and the hips are at 90 degrees. It can be a little bit shortened too. That's a little bit more comfortable. So on the front leg, first assessment of it is, can you take your hands away? And if not, there's probably some internal rotation issues in the opposite hip. We can get into that after. The first part of the stretch though is kind of turning torso towards the front thigh, and then just kind of walking down this way. And I feel this along the back side of my front leg. And if not, there's probably some internal rotation issues in the opposite hip. So I'll come down here and I use it as a breathing count. So maybe 5 to 10 breaths in each position. The breath in. Exhaling and just sinking a little bit deeper into it. And do about 5 of those. And then I would come up and out of it, and then drop back onto, if my left leg is forward, I drop back onto my left elbow. Immediately I have a stretch coming through the front of my thigh, to the hip flexor. Same thing, exhale. As I lean back, my knee wants to come up, so I'm just gonna kind of split the difference and stay here, the knee down. I'll come back up to neutral. Should feel a little bit easier to sit here. If not, there's one more exercise you can do here, is to lean away a little bit just so that there's no discomfort in the hip, and try to lift and activate the muscles to lift this back heel off the ground. When I do that, I get a little bit more hip mobility, and it should be a little bit more comfortable to sit upright. It is. Then after you do that, switch to the other side and repeat. So 90-90 or shin box, rotate the torso, drop down over the knee. 5 breaths on one side. Up. Drop back onto the elbow. Start to feel the stretch here. Right now I don't feel that, so I'm gonna walk the hip back a little bit further. Drop back and stretch. And none of this bothered my back, but if it did, I wouldn't do this exercise right now. So just listen to my body for that. That second exercise we were working on today is a rotation exercise for low back and hip. Most people know a version of lying on their back, crossing one leg over the other and pulling up to get a piriformis or a posterior hip stretch. A little rock is nice too, and then for me, with the low back injury, it was a muscle strain, so dropping over to one side. Exhale and let yourself open up here. With each inhale, there's some tension that develops. Exhale, try to let tension out. Just sort of be aware of where you're holding most tension. And I would do 5 to 10 breaths here on one side. Come up, switch, and rock to the other side. And this can be done as a stretch like we're doing here with a breathing release, or it can be done as an exercise. We're here and we're rotating, touch, and back. Touch, back. Now we do 10 to 15 of these. Quality movement though, so if it's hard to do 3, just do 3. On one side, then switch. And I'm using my elbows as a brace, but I'm not pushing into the ground hard to do it, so it's just keeping me from rotating. And there's always one side that feels easier than the other. So that's that one.